and this is Charlotte. She's my other sidekick. She was another dog with no name, and now she's my companion. She comes to work with me every day, and she's just adorable. Charlotte in the past, as you can see from her face, has sustained a vehicular injury on top of her head, so she's had trouble with her mouth chewing, but she's has completely recuperated, so we're going to use her to look in her mouth. Now, a normal mouth in a dog contains 42 teeth, and to maintain a good mouth in a dog is a lot of work. Just like in humans, we have to do things to maintain the health of a dog's mouth or a cat's mouth. The main thing is we want to get them trained from the time they're really young that for us to put our fingers in their mouth is a positive experience. I can only imagine how invasive that is for them and wondering like, why are you doing that to me? So make sure from the time they're puppy we get them used to having their mouth handled. So for example, we just touch them over the canine where they don't object very much, and then you work your way back. It can be a life-saving procedure. If you need to remove something from their mouth quickly, they've eaten something they should not have eaten, you want to be able to get into their mouth and take it away. So dogs have 42 teeth. And that means if we look at the dog's mouth, there's 3 incisors at the top, there's 1 canine, there's 4 premolars, and 2 molars in the back. That's on the top jaw. The bottom jaw, the mandible, is the same except there are 3 molars in the back. So to keep a dog's mouth healthy, there are different ways we can go, but certainly the gold standard is to brush teeth. I know it's hard. Most of us don't have time, but that is the gold standard. And the idea behind brushing teeth, it's not so much to dislodge all the food, but it's mostly to break the biofilm that is on their teeth, which is made up of neutrophils, bacteria, salivary proteins. We're just trying to disrupt that. So that's why the point of toothpaste, I'm a little iffy on toothpaste. Humans, we spit it out. I don't like dogs swallowing toothpaste, but the idea is really to disrupt the biofilm. So this is my really handy little light, and that's how I assess a lot of mouth for dental disease in terms of how much plaque is there on the mouth. This light will shine orange when there's a lot of bacteria in the plaque, and otherwise it'll remain normal. So do you see here we can see sparkling white teeth, and sometimes we see staining on the teeth, and I'm not too worried about the staining. So can you see the top and bottom? This is staining. I'm not too concerned, and as you can see, it doesn't affect the gums. But when we come back here, you can see how it's taking orange, and that means we do have some plaque and bacteria in there. So this is one of the tools, and after we've done a dental cleaning, I use the same light to make sure that we've gone over everything we need to see. So also when we look at the anatomy of a tooth, to be super basic here, we have the crown and we have the root, whatever sits above and below the gum line. The crown of the tooth is made up of the pulp, the dentin, and enamel. We have enamel on our teeth as well, that's the white part, and it's very dense. Now the main difference with dogs and cats and humans is that in humans, the enamel, which is very dense and hard, is 2 millimeters, whereas in dogs and cats it's only 0.2 to 0.3 millimeters on average. So very fragile, and that comes to the point when dogs are chewing on rocks and chewing on bones, how easy it is to disrupt the enamel. The other thing about the enamel is once a tooth has erupted, that's it. The enamel has been deposited. We cannot deposit it again. So we want to protect the integrity of the mouth as much as possible. So 2 points to remember. So make sure it's a positive experience for our dogs or cats to have their mouth handled. So right from the beginning, make sure we give them a positive reward for this, and that can be petting, high-pitched voice, good girl, or a treat. And number 2, if you can, start taking pictures of your dog's mouth when they're young, and that way we can see the progression of if and when we have dental disease.